This is the story of an actual patient named Ava who received treatment with Danielza. What is Danielza? Danielza is a prescription medicine used in combination with a medicine called granulocyte macrophage colony stimulating factor, GM-CSF, to treat children 1 year of age and older and adults with high-risk neuroblastoma in the bone or bone marrow that has come back, relapsed, or that did not respond to previous treatment, refractory, and has shown a partial response, minor response, or stable disease to prior therapy.
It is not known if Danielza is safe and effective in children younger than 1 year of age.
We have 4 children. We had 4 kids in 3.5 years, which is quite challenging. And Ava is our youngest. Ava's a force of nature. She has just a smile that you feel. You don't just see, you feel. She's got older siblings and she doesn't, take anything from her brothers or from her sister. And that's, I think, a byproduct of her going through this and having cancer. I think there's not a whole lot that scares Ava.
I brought her to an oncologist at the local children's hospital, and he walked in and said, she has cancer. And I didn't think I was hearing him right.
Ava was diagnosed with stage 4 neuroblastoma. And that was something we had never heard before. After we finished that, Ava relapsed, and we found a small spot in her chest on the 2-year anniversary of her being declared NED, no evidence of disease. The moment I heard that Ava had relapsed was worse than the moment I heard she had cancer. And the reason is because we had already been through a treatment protocol. We knew what this meant. We knew what the science said about the prognosis for relapsed neuroblastoma. And it was totally devastating to us. But in that moment, I was in the recovery room with Ava, and a doctor walked in and wrote out a protocol on a handwritten note. And that protocol included the treatment that was so important for Ava to get.
It is not known if Danielza is safe and effective in children younger than 1 year of age.
We knew that in a relapse setting, we had to use every tool and resource that was available to us.
We knew this therapy, this treatment was available, and we didn't really know a lot about how it was administered. But as we began talking to the doctors, they let us know that it may be possible to actually perform the treatment outpatient, which was something that was very attractive to us.
My turn? Wasn't it my turn?
No. Believe that.
Oh no, now what happens? I have to take all of these?
2 kings.
When Ava went in for treatment and she would receive the medicine, she would experience some pain in her stomach. And they would put heat pads on her stomach, and then they would give her some medicine to help with the pain. She was able to then relax and go to sleep.
For us, we were able to manage that pain with the administration of the pain medication.
Important safety information. Danielza can cause serious infusion-related reactions that require immediate medical attention. Infusion-related reactions are common with Danielza. Tell your healthcare provider right away if you get any signs or symptoms during or after your Danielza infusion, including swelling, itching, redness or flushing, and other signs listed on screen. Danielza can cause nervous system problems that may be severe, such as pain including pain in the belly, bone, neck, legs, or arms. Talk to your healthcare provider right away if you have new symptoms or worsening of nervous system problems. Please see additional important safety information at the end of this video.
She never once said, I'm not going, I'm not doing that again. She never felt that. It was like, okay, we're going back to the hospital. We need to be there in the morning early. Okay, Mommy, let's go.
But it was really important for us to feel comfortable with the doctors and the nurses who were administering the treatment. And in our case, when we received it, they really did a great job. And we knew that they would because they had a track record of doing this and administering it. But with something like stage 4 neuroblastoma, and in particular, relapse stage 4 neuroblastoma, you want to go where the experts are. And you want to go to the experts who have a track record of treating children. And that's what we did. And we're so lucky to be able to have done that. And so I would encourage parents to really think about it, to research it, and make a determination if it's right for their kids. I lost hope when she relapsed. And I found hope when I saw a plan on a piece of paper that included the treatment. And I knew that there was a plan. And so for me, that's what I was able to rely on, having a plan and working to execute the plan.
When I look at her strength and what she's accomplished, it's an amazing thing, an amazing gift we've been given. I don't take it for granted at all. And I'm in awe of Ava every day.
Consumer indication and important safety information. DANYELZA, naxitamab-gqgk injection for intravenous use. What is DANYELZA? DANYELZA is a prescription medicine used in combination with a medicine called granulocyte macrophage colony stimulating factor, GM-CSF, to treat children 1 year of age and older and adults with high-risk neuroblastoma in the bone or bone marrow that has come back, relapsed, or that did not respond to previous treatment, refractory, and has shown a partial response, minor response, or stable disease to prior therapy. It is not known if DANYELZA is safe and effective in children younger than 1 year of age. Important safety information. What is the most important information I should know about DANYELZA? DANYELZA may cause serious side effects, including serious infusion-related reactions. DANYELZA can cause serious infusion-related reactions that require immediate medical attention. Infusion-related reactions are common with DANYELZA. Tell your healthcare provider right away if you get any signs or symptoms during or after your DANYELZA infusion, including swelling of your face, eyes, lips, mouth, or tongue, itching, redness on your face, flushing, skin rash or hives, trouble breathing, cough or wheezing, noisy, high-pitched breathing, feeling faint or dizziness, low blood pressure, nervous system problems. Talk to your healthcare provider right away if you have new symptoms or worsening of nervous system problems, including severe pain from nerves, neuropathic pain, including pain in the belly, abdomen, bone, neck, legs, or arms. Pain is common with DANYELZA and can be severe. Inflammation of the spinal cord. Signs or symptoms may include weakness in your legs or arms, bladder and bowel problems, pain in back, legs, or stomach, abdomen, numbness, tingling, burning sensation. Reversible posterior leukoencephalopathy syndrome, RPLS, also known as posterior reversible encephalopathy syndrome, PRES. PRES is a condition that affects the brain. Your healthcare provider will monitor your blood pressure and check for any neurologic symptoms after your DANYELZA infusion. Signs or symptoms of PRES may include severe headache, vision changes, changes in mental status such as confusion, disorientation, or decreased alertness, difficulty speaking, weakness in your arms or legs, seizures, numbness, tingling, or burning sensation in the arms or legs, nervous system problems of the eye. Signs or symptoms may include unequal pupil size, blurred vision, trouble focusing your eyes, larger pupil size, dilated, decreased ability to see, sensitivity to light, problems urinating or emptying your bladder, prolonged urinary retention. Do not receive DANYELZA if you have had a severe allergic reaction to naxitamab-gqgk, the active ingredient in DANYELZA. Ask your healthcare provider if you are not sure. Before receiving DANYELZA, tell your healthcare provider about all your medical conditions, including if you have high blood pressure, have heart disease, are pregnant or plan to become pregnant. DANYELZA may harm your unborn baby. Your healthcare provider will do a pregnancy test before you start treatment with DANYELZA. Females who are able to become pregnant should use effective birth control, contraception, during treatment, and for 2 months after your last dose of DANYELZA. Talk to your healthcare provider about birth control choices that may be right for you during this time. Tell your healthcare provider right away if you become pregnant or think you might be pregnant during treatment with DANYELZA. Are breastfeeding or plan to breastfeed. It is not known if DANYELZA passes into your breast milk. Do not breastfeed during treatment and for 2 months after your last dose of DANYELZA. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of DANYELZA? DANYELZA may cause serious side effects, including C. What is the most important information I should know about DANYELZA? Swelling of the heart, Myocarditis. Myocarditis has happened in adolescents ages 12 through 18 within days of receiving DANYELZA. Tell your healthcare provider if you get any signs or symptoms of myocarditis, including chest pain, shortness of breath, irregular heartbeat or feel like your heart is racing, high blood pressure, hypertension. High blood pressure is common in people who receive DANYELZA. Your blood pressure will be monitored during your DANYELZA infusion, and at least each day on days 1 to 8 of each DANYELZA treatment cycle. Tell your healthcare provider right away if you get any signs or symptoms of high blood pressure, including headaches, seizures, nausea or vomiting, chest pain, dizziness, visual changes, shortness of breath, feeling that your heart is pounding or racing, palpitations, nosebleeds, decreased blood pressure, orthostatic hypotension that can be severe and require hospitalization. You may feel dizzy, lightheaded, or pass out, faint when you rise too quickly from a sitting or lying position. Your healthcare provider will monitor your blood pressure before you start and during treatment with DANYELZA. The most common side effects of DANYELZA include fast heart rate, vomiting, cough, nausea, decreased white blood cell, red blood cell, and platelet counts, diarrhea, decreased appetite, tiredness, skin rashes, decreased level of potassium, sodium, and phosphate in the blood, hives, fever, headache, injection site reaction, swelling of the body or only in one part of the body, anxiety, irritability, increased liver function blood tests, decreased blood sugar level, decreased calcium levels in the blood, decreased protein levels, albumin in the blood. These are not all of the possible side effects of DANYELZA. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088.